process.
Okay. So is it possible to include the recovery rates from those hospitalized and those who have tested positive in your snapshot? I think acknowledging the positive rates would help create a more balanced perspective.
Yeah, yeah, absolutely. Again, we definitely want to celebrate the positive things, the recoveries. A couple months ago, I mean, we make a big deal, the hospital does, when somebody recovers. We have dozens and dozens of our employees that come and line the hallways as we wheel that patient down out the door to their loved one, playing a song that they've selected, and just a raucous standing ovation for them. It definitely is the highlight of everybody's day. So, and that is happening more and more. That's a good sign. I actually think the death rate is falling. Even though the positivity rate and the hospitalization rate is climbing, that the percentage of people that are actually now dying is actually declining. And maybe that's because we're seeing a younger population that's now being hospitalized and they're more successful. Again, I reported at the state level, almost half of the people that have died statewide are over 80 years old. And many of them died early on in the pandemic, like what we saw in our nursing homes. So I do think the number of deaths are declining, but I don't want people to, okay, take a sigh of relief and, okay, we can relax now because even if I get hospitalized, I'm not going to die. That certainly is proving to be the case for the most part. I don't want you to be taking those chances, but what's more important is we've got to keep the hospital available to take care of all the healthcare needs of the community. And so if we can avoid an unnecessary and avoidable hospitalization because we practice good habits, we keep ourselves from getting the virus, we keep ourselves from having to be hospitalized, that significantly benefits the community.
Okay, thank you.